Hi and welcome to Let's Get Distracted, episode 22, where every Sunday I come to you with health and wellness education. Tonight we're going to be talking about women's health issues, and in particular, we'll be talking about incontinence. I'm Michelle Burke, coming to you live from Annapolis, Maryland. Many of you know, after 30 years in the corporate tax world, I went out on my own in January and created health and taxes. There are only two things certain in the world: death and taxes. I'm here to help you flip the switch on aging and keep the IRS at bay. So like I said, tonight we're here to talk about health and wellness, and I'm going to welcome Dr. Maria Canter. Welcome.
Thank you, Michelle. Nice to be here.
Really excited to have you here, so thank you. Let me just click one thing over here. There we go. Dr. Maria Canter is board certified in female pelvic medicine and reconstructive surgery, as well as obstetrics and gynecology. She was one of the first surgeons in the country to be boarded with both specialties. Dr. Canter works with each individual patient and customizes treatment plans for their specific needs. She focuses on improving her patients' quality of life by using minimally invasive techniques. Dr. Canter was born in Washington, D.C. and grew up just outside the city. She attended Georgetown University School of Medicine and completed a residency in obstetric. I can't say that. OB and gynecological at the Georgetown University Medical Center, graduating with minimally invasive endoscopy award. A 3-year fellowship ensued in female pelvic medicine and reconstructive surgery. While in fellowship, she received awards for academic achievement, clinical investigation, and the prestigious American Urogynecology Society June Allison Award for research in urine protomix.
Got it.
You're going to have to explain to us what that is here in a minute. Dr. Maria Canter opened Urogynecology Center, Northern Virginia, in May 2016. Dr. Canter has been in the practice in Northern Virginia for over 10 years and is proud to say she loves what she does. And I think from tonight, you'll see that she's passionate about what she does. So without further ado, let's welcome Dr. Maria Canter. Welcome.
Thank you so much.
So Maria, tell us a little bit about your story. How did you, why did you choose this profession, and just a little bit more about your career?
Great. Well, when I went to medical school, I had the intention of just trying to help everybody. Wasn't quite clear on what I wanted to do, but was quickly drawn to surgery. I had a history of doing research at the NIH where I was able to witness surgery and was very excited about that field. I actually developed a passion for cardiac surgery, but somehow this evolved into a passion for women's health, and I sort of found my footing in urogynecology. I enjoy working with women. I enjoy improving quality of life. It's a version of happy medicine, if you will. So these are elective procedures to improve quality of life. Nobody is usually having any detrimental outcome or anything like that. So that's basically it. We enjoy taking care of women and improving their lives.
Well, I think that's really special that you got an opportunity to be at the National Institute of Health. That's for people that don't know, that's local to us, and that's really fantastic. But we're all very glad that you chose this path towards women's health, and that you're here to share that with us. So let's talk about incontinence. Let's talk a little bit about the different types of incontinence.
So there are a few different types of urinary incontinence. There are two main types that we typically see. There's stress urinary incontinence, which some patients get a little confused and think that means that they're stressed out or anxious, and that can cause leakage. But it's really a stress or an increased pressure in the abdomen. So, for example, laughing, coughing, sneezing, jumping on that trampoline with the kids, that's stress urinary incontinence. So, an activity that results in involuntary loss of urine. Another common type of urinary incontinence is urge-related urinary incontinence. So, a woman gets a sudden urge and may not get quite enough time to get to the bathroom, get her pants down to empty her bladder before it starts to come out. So those are the two main types of urinary incontinence we'll talk about today.
Okay, great. I mean, just it's a lot more common, I guess, than we can imagine, and it's nice to know that there's something out there. So talk a little bit about what causes either the stress or urge incontinence.
So the stress urinary incontinence can be caused by two main things. So there can be an abnormal extra movement of the urethra. So some of you may not know what the urethra is, so I'll demonstrate. So let's say that my hand is a bladder and the urethra is my finger and the urine comes out this way. And so over time, there may be a lack of support and the urethra may wiggle a little too much when you're active, and that can result in a little bit of a loss of urine. If you look up into the urethra, there's supposed to be a sphincter muscle there that's super tight that keeps the urine in while you're out walking around and doing your daily activities. If that becomes very weak, called a sphincter deficiency, that can result in loss of urine. These things can happen over time. We call it multifactorial. So why do you develop urethral hypermobility? Why do you develop sphincter deficiency? Well, things like vaginal deliveries, pregnancy, chronic straining with constipation, chronic straining with heavy lifting, the tissues thinning out as women go through menopause over time. Those are the main reasons why. As for urge incontinence, there are a lot of different reasons why a woman could develop urge urinary incontinence. The most common type is as we get a little bit older, this can happen. We may not exactly know why, but there are other reasons why this could happen. So neurologic conditions such as multiple sclerosis or stroke, even a spinal cord injury could result in overactive bladder or urge-related urinary incontinence.
Oh, great. I mean, it's good for women to be educated on what kind of things could cause it so they know that they're not alone and that it happens. Here's the reason. It's not just something that just, came up. There's a reason what caused it, and that coming to see you could probably identify what that cause might be. So tell us a little bit about the treatments. Definitely want people to know what they could do about it.
So the treatments vary for each condition. However, what they do have in common for treatment is pelvic floor physical therapy and passive stimulation. So pelvic floor physical therapy is when you meet with a specialist, someone who's trained in all kinds of muscles, but especially the pelvic floor muscles. They'll teach you standing, sitting, lying down exercises, in addition to Kegel exercises. But it's not all Kegel muscles that are involved in pelvic floor physical therapy. Very high success for patients. Many patients will improve with physical therapy. Not everyone will get where they want to be. Then there's passive stimulation, and that's Kegel muscles. So whereas with physical therapy, maybe 10-20% of it is Kegels, with passive stimulation, 100% Kegels. You're either placing little stickers on the outside to contract the muscles for you, or we have a chair called the Emsella chair you can sit in. You keep your pants on, so that's a nice feature. There's no vaginal probes, no stickers. Keep your bottom pants on and you sit on the chair and it contracts your pelvic floor for you. So those two types of treatments treat both stress urinary incontinence and urge-related urinary incontinence. Now, if we just focus on the stress urinary incontinence, we'll focus on some of the traditional methods for treating stress incontinence. So beyond physical therapy, there's something called a pessary. This is a way to sort of obstruct that urethra when you're active. So let's say, for example, you have a hypermobile urethra. So if your bladder's here, your urethra's here, when you're active, urethra wiggles a little too much. So if we were able to sort of kink off that urethra when it's active, perhaps we could improve or eliminate leakage when you're active. So I have a pessary here I can show you. So it's a little ring that it's very squishy, and you place it into the vaginal area, and it's supposed to sit so that your urethra sits where that knob is, so that when you're active, the urethra kinks around it, and hopefully you don't leak, or at least you don't leak as much as you did. This can also be used for women who struggle with prolapse or dropping of the pelvic organs into the vaginal area. Additionally, there's surgery. And with surgery, there are several options. Our current gold standard is a sling surgery. I was speaking with a friend earlier today, and we were talking about urinary incontinence and this 20-minute surgery that we can do, minimally invasive, same-day procedure. You go home the same day, and she says, oh my gosh, you can change someone's life in 20 minutes and they don't even know it. I thought, what a cool way to think about that. Now, surgery is not for everybody. Of course, we have to find the right people. Not everyone's a candidate, but we do a preliminary workup to see who is a good candidate and who's likely to have the best success with surgery. Now, yes, go ahead.
No, go ahead. I think it's wonderful to know that surgery may not be required, and if it is, it may be a very simple procedure. So yeah, that's great to know.
Absolutely. And then in terms of urge leakage, there are a few more options. So we've got the physical therapy we talked about. We've got the passive stimulation. In addition to that, there are medications. So there are a variety of medications that you can take to help calm the bladder. There are some side effects associated with some of these medications, so they're not for everybody, but certainly there are some people who do well with the medication and use it for quite a bit of time. If you're not a candidate for the medication, or you don't like the side effects, or maybe it didn't work for you, there are additional options. So we have two forms of something called neuromodulation, and we have Botox. Well, everyone kind of knows what Botox is, right? You inject it into a muscle, it helps that muscle relax. So for overactive bladder, we can take a little bit of the Botox medication, inject it in a little bitty area of the bladder, and that helps relax the bladder enough to give you extra time to make it to the restroom and hopefully stop leaking. As for neuromodulation, there's two forms of this. There's a form called posterior tibial nerve stimulation. I just call it electroacupuncture. I think that's much easier for people to remember. It's a simple, one little tiny acupuncture needle. It's almost like a little mosquito bite when it touches your skin. And we attach it to a little battery that stimulates the nerve that goes to the bladder. And we do this weekly for 12 weeks and once a month after that. And over time, you can start to see improvement in bladder function. Well, if you don't want to come to the office, or you're not a fan of electroacupuncture, you can get an implanted version of this, either called Interstim or Axonics, two varieties. Both have MRI compatible technology, which consists of a little wire and a battery that go under the skin, and the battery lasts for at least 15 years. And that version is called sacroneuromodulation. So a lot of different options for women these days, but those are the most traditional options.
I love that there are so many options, because I would, being new to even thinking about this, I wasn't even aware of it. And so you mentioned when we were speaking before that there's some new things out there. You want to talk a little bit what's on the horizon, or what new treatments you're seeing?
Sure. So we have a new field, well, relatively new field, called regenerative medicine. And in this field, many of you have probably heard of energy-based devices called vaginal rejuvenation. There's platelet-rich plasma. Some of you may have heard it called O-shot. So with energy-based devices, there are lasers. There are CO2 lasers, erbium YAG lasers, there's radio frequency. So we won't get into the details of those things tonight, but some of these technologies have been found to either improve the skin of the vaginal area and or improve urinary incontinence related to stress urinary incontinence. There are a little anecdotal evidence claiming that urge may be improved as well, but no real definitive data on that yet. A lot of pilot data in energy-based devices. In terms of platelet-rich plasma, this is just your own platelet-rich plasma. So your blood is drawn, it's spun down, the platelet-rich component of it is removed from that whole tube of blood, and then the growth factors in the platelets are released, and it's injected into the joints of athletes, especially professional athletes, to help with any joint injuries or discomfort. It's been injected in the scalp to grow hair. It's been used in the face for aesthetics, and now it's being used in the vulvar and vaginal areas to improve sexual dysfunction or to improve urinary symptoms such as stress incontinence, urge incontinence. Now, again, there's pilot data, and these are new and evolving fields, so there's nothing really definitive. I can't tell you to rush out and go get this done, but these are great options for some patients.
Yeah, and it's just great to know that so much research is being done. There's a lot of focus in this area, and I would imagine over your career, you're seeing more and more, and I think that's really, really exciting. You just mentioned athletes. Tell us how frequently do you see athletes? What kind of issues do they have with incontinence?
Well, I do have quite a few athletes actually, and they do at times, not all athletes struggle with stress urinary incontinence, but some do. And part of their issue is the downtime of surgery. And so while the surgeries are minimally invasive, you do need time to heal. So you don't just want to go out the next day and perform in competition. So we usually ask patients to take it easy for 6 weeks. Well, many athletes, that's impossible because they can't give up training, they can't give up tournaments, etc. And so I have a couple patients in particular who decided to pursue the avenue of energy-based devices and platelet-rich plasma. And so I had one athlete who we did a radiofrequency treatment on, and she did very well. However, she continued to have a little bit of leakage when she was really in tougher competition, and she wanted to do something about it. So we repeated her treatment. We added platelet-rich plasma, and now it's over a year, and she's still doing very well. So that was an exciting outcome for someone who felt very limited in their ability to have surgery.
Yeah, that makes sense, and it's great to know again that there's those options. Now, just the whole idea is that this can be embarrassing, not something we're used to talking about. And so, we're out there I'm out there right now, we're trying to educate people and let them know that you're out there, that you can come to you can ask questions. So I wanted to share with our audience how they can reach you, and maybe you can talk about how people can best reach out if they want more information or if they want to have a discussion with you.
Well, I love that you have a link for our website up there, because that's one of the best ways to reach us. On the website, we have our phone number. So if you like the traditional phone call, please certainly give us a call. We have HIPAA compliant platforms on our website, so you can actually text us. And it's all HIPAA compliant and secure. You could even email us through the website. So very easy.
I will post this website in the comment section when we're done, so people can see that. And feel free, if you have questions, post them in the comments below. Dr. Canter will reply to those, but I know it's a kind of sensitive subject, so if you don't want to post it, feel free to reach out to this website or give her a call through her office number there, as is available on her website. So this has been really informative and really helpful, and hopefully our audience feels the same way. I know that you have a particular soft spot, a big passion for breast cancer patients. What would you like to tell us about that?
I do. I find that, it's hard enough to have a diagnosis of breast cancer and have changes made to your body. And what a lot of people don't really talk about are the changes in sexual health that can occur. So when you're on certain chemo or you're on anti-estrogens, there can be changes that make it very uncomfortable to have intercourse. And so I talk with patients about things like moisturizers, lubricants. We talk about hormonal therapy. So if it's okay with your oncologist, sometimes it's okay for you to use just a little vaginal estrogen or DHEA or something like that in the vaginal area to improve vaginal health. Furthermore, there is some exciting research happening with platelet-rich plasma. So just like we talked about before, the PRP, some people call it an O-shot. There's a phase 2 trial in breast cancer patients using platelet-rich plasma to improve vaginal health. In the 20 patients who were treated, 19 requested repeat treatment. So that's very promising. That wasn't super uncomfortable for them since 19 patients wanted to repeat treatment, but there was benefit in 20 patients. So we have a lot more exciting things coming down the pipe. There are energy-based devices being studied in vaginal health for breast cancer patients as well.
Yeah, I think that's such a wonderful message. As people are going through treatments for breast cancer, they're already overwhelmed with so much that's going on and just feeling maybe disconnected, maybe unloved, however that expresses themselves. And to know that there's ways to help them and even acknowledge sexual dysfunction, to just acknowledge it and help them out has to mean so much to them. I think that's really special. So, and wrapping up, anything else that you would like to share with us?
No, I just want to thank you so much for your time, Michelle. It's great to be here. I hope some people learn some things. If you have questions, I'm happy to field them for you. Just reach out.
Wonderful. Thank you. I really appreciate you being on the show, and thank you so much for coming on over the Labor Day weekend. And to all of our listeners out there, thank you for joining us, or thank you for catching us in the replay. And join us again next week with Let's Get Distracted. We'll have another health and education session for you. So have a good night, and thank you.
Thank you.